Okay, so I think it will be challenging to be extremely interesting and inspirational after Pablo, but we'll stick to the task because it was an amazing talk. My name is Shachaf. I'm the Director of Internal Innovation at Clalit, which is the biggest provider of health services in Israel. And I'm just in the role of moderator today, and I'll let my panel, my panelists introduce themselves.
Hello, everyone. My name is Elena Vidal. I'm the Director of the area of health services and quality of healthcare we provide to our clients. So we provide digital services for our clients in this new era.
Hello, everyone. My name is Pedro Álvarez de la Gala. I combine two different roles. I'm managing a business unit in the biopharmaceutical business unit at Novartis, pharmaceutical company. And at the same time, I belong to Novartis Biome. Novartis Biome is a global networking of our digital innovation hub that what looks is for identifying startups and different partners to provide solutions to improve patients' quality of life.
Hi, good afternoon. My name is Mario Alonso Puig. I'm currently the president of the IE Center for Health, Wellbeing and Happiness. We have people from more than 100 nationalities, and we teach the students and also who are involving the staff in this process. We teach them how they can really train their body, their mind, and their soul to be not only more effective and more efficient in their current lives, but above all, how to be happier. Why the mind, the body, and the soul are so deeply connected. So if we want really to approach this sense of happiness in a holistic way, we really need to address some of the important things about the body, some of the important things about the mind and about the heart. By profession, I'm a general surgeon. I practiced surgery for 26 years, but unfortunately, during my medical career, nobody taught me anything about the importance of emotions in healthcare, the importance of emotions in the sense of well-being. So this has been a long journey, and I'm very honored to be with all you and all of you sharing what I have seen throughout my life that can be useful to foster health and a sense of well-being.
Cool. So we agreed before the panel that we'll just have this conversation and we'll see where this is going. We don't have this planned roadmap for the conversation. I'll tell you where I'm connected to this subject. I'm as part of leading the whole internal innovation activity. We're doing a lot of projects that are trying to improve the quality of lives for patients. But the more I deep dive into this subject and the more I try to understand it, I realize that quality is something that is very hard to define, and it's even more complex to try to figure out how do we improve it. And I think the diversity of the panel just reflects that, because there are so many ways to interact with this subject. So let's start with a question that I'd like to address all the panelists, and that is, how do you think you're improving the quality of life for patients, and how is that different from what we've been doing in the past so far? We'll start with you, Elena.
Okay. So I think that healthcare is being more successful, or is achieving a successful way in improving life care of our patients. When we have understood that we had to incorporate the patient's view, the patient's perspective in the healthcare process. So we have redesigned it by introducing all this patient experience, patient expectations, because the patient, the sphere of the person has three dimensions, let's say, physical, emotional, and social. And all these three perspectives we have to take into account to design the healthcare and to meet the patient's needs. So technology has also improved, has accompanied this process, and has provided a more adjusted healthcare, considering all these things. And I think that healthcare right now is achieving is empowering patients in terms of giving them some tools for self-care and to make patients an active agent in taking care of their own health, right? So what are your feelings about this?
You know, if I had to summarize how to improve the patient lives, we have been focused as an industry for many, many years in this issue. But I would say that collaboration is the new disruptive medicine. At Novartis, we are a company that we are really, as an industry, we're really extremely focused on science and looking for evidence on efficacy and on medicines. But now what we have is the technology. So what we need to do is to combine both areas to really improve quality of life on patients. We have been talking for a long time about patient centricity. And this is really important. But for me, the change and the difference is that in the past, we have been very focused working for patients. Maybe now the new paradigm is to work with patients and with other stakeholders to improve their quality of life. And from the emotional point of view, that you really have a very, very deep knowledge, Mario. What do you think?
Well, I always consider myself a beginner, so thank you for the generosity of your words. I'm just a beginner. You know, when I spoke with patients for so many years, I saw that there's something that goes beyond the disease. You know, in allopathic medicine, which is the kind of medicine that is being taught at schools, medical schools in the Occidental world, we don't pay much attention to the body itself. We pay attention to what we can do to repair the body. And we forgot what the great physicians from Greece 2,500 years ago, Hippocrates, said. It was a warning to all physicians. He said, never ever forget that the element which really cures, heals, is the body. You just support the body in its healing process. So unfortunately, when a physician is speaking, or a health provider is speaking with a patient, he or she usually forgets how important it is to understand what's happening in that human being, the feelings, the way that person perceives reality. So we are not being trained in the beautiful art of compassionate listening. Now we know, even from the molecular biology, that when a patient feels that he or she is being understood, even at a molecular level, the genes respond in a different fashion. So I think it's very important what you are saying, what you all are saying, that it's a team. It's not, I am the health provider, you act like a patient, you expect some help from us, but let's work as a team. Let's use what science have taught us and what we can provide from the scientific point of view, and also let's engage the immune system, all the systems in the body which are so powerful. Just to give you an example, during World War II, there were people who were badly wounded. I mean, they had open wounds in the belly, and they didn't have any pain. How come that they didn't have any pain when they arrived at the centers where they were being helped? Because the body releases endorphins, which are extremely powerful analgesics. So we need to be aware that there is a huge number of resources within all of us, and this is the reason why, from my point of view, we need to work as a team. And if we do that, we will be much, much more effective.
I'm going to cut the conversation just for a minute because we forgot to introduce Max, which is our digital panelist. Oh. Sorry, Max, I didn't see you there. If you could just introduce yourselves and maybe follow up on your perspective on how are we improving the quality of life for patients and how is that different from what you've done so far?
Yeah, absolutely. Can you hear me well?
Yes.
Brilliant. And thanks so much for inviting me. And I'm so sorry I can't be there in person. So I'm the CEO of Birdie, which is a startup in health tech in London. And we provide a range of solutions and technologies, software, hardware, and machine learning to better look after the elderly, particularly at home. And we do that by empowering the range of care providers, nurses, caregivers, and GPs and the likes, to better look after the elderly. And so it's really about personalizing the care. It's about also making the care much more preventative so that all elders can be better off, so they can live longer and healthier at home. And just to jump on Mario's last point, I absolutely agree with you. What we realize in the space of elderly care is that we've given the keys to our elders' well-being to doctors who basically will just look at the medical side of things and will provide a treatment which is usually medication and many medication. And we believe that you can actually take a much more holistic approach to care, which means also social connection, diet, and physical exercise, cognitive exercise, which actually are much more powerful than medication for the health outcomes of the elderly. And so we're taking a much wider approach to assess the needs of someone, but also in the care plan to make sure that we embed in the care plan many more factors than just medication or doctors. And the purpose is really to transform the aging journey. That means to actually make sure that these people can be better off, live longer and healthier, but that is also more affordable for society overall. So absolutely second you, Mario, there.
So thank you for that. But if with your permission, I'd like to challenge what we're saying, because I hear us talk about taking a holistic approach to patients and looking at them in different dimensions and using technology to do that and looking at the powers that patients have as human beings. And yet, in my experience, this is a very traditional industry. I mean, these assumptions, these approaches, they might seem intuitive to most of the people in this conversation, but when we try to lead innovative projects, it's not easy. No. They're not necessarily welcomed with open arms by the people that we work with. And I want to ask about that. I wanted to ask about the challenges of implementing these approaches and how do you deal with them? We'll start with Mario this time.
Well, I watched a conference that you did in Israel, and you spoke about the importance of asking questions. And asking the kind of questions that, put us in a very difficult situation because we are challenging the paradigm, the current paradigm. And you also said in that conversation, in that conference, that you really need to be brave enough to challenge that established order. I think it's exactly the same. I mean, even for us, you can imagine if you have gone to a physician or you have gone accompanied a relative or a friend to a physician or a health provider, you have experienced within yourself how important it is, the kind of bond, emotional bond that you establish with that health provider. And your body knows too. The body has a wisdom which the head is unable to understand. But what's the challenge? The challenge is that, unfortunately, we live trapped in a reality which is not the deepest reality. And many people have been pioneers in their fields, were really criticized for a long period of time. They were attacked because their ideas seemed to be quite weird, quite strange. So what happens when we relate to uncertainty? That we feel afraid. Instead of embracing uncertainty as opportunity, we see uncertainty as a threat, and then we get defensive. So it's about, becoming able to be surprised by life. It's to really acknowledging, like Socrates did so many years ago, I don't know, but I want to know. So I'm really in a disposition, in an attitude of listening. Then we start to understand. I think the greatest barrier that we all human beings have to overcome is selfishness. It's an ego barrier.
But Mario, I'll do a follow-up question on that. What do you do with doctors that are trained not to be surprised from life? This is what they do. They are coming from a profession that for centuries is being designed to help them not to be surprised from life. How do you encourage them to take new perspectives like that?
Well, I have given many talks to physicians in different fields, surgery, medicine, oncology, and so on and so forth. And the result has been the following one. Let's imagine that you all were physicians, let's imagine, or health providers, and I share with you something about the relationship between the body, the mind, and the soul. When you leave this place, 85 of you would be very surprised and very happy because something has opened up. The rest would be very upset with me, very upset with me. And I have to accept that. I mean, you cannot force that. You cannot be dogmatic. You share with other people what has transformed your life and what you have seen that has the power to transform other people's life. But that's a proposal. You cannot force them, because one of the worst things that I have seen is when people get a better understanding of some things, they think that they are above the rest of the people. And I think that that creates a lot of resistance. So it's about sharing, and with time, people will start to at least explore that. And little by little, that paradigm will shift. That's what I've seen.
Thank you. Pedro.
Yes, building on your answer, I think we need to move from ecosystem to an ecosystem. And I think, Pablo, thank you for your conference, but I've been inspired about what you said. And I think this movement needs people that inspire other people to do this change. I think the challenge is not about technology. The challenge is about people mindset. And if we can inspire people with a sense of purpose, I think, and Pablo is a good example, what are the things that we are able to do? So for me, this is the summary. It's again related with collaboration, I think, but collaborations needs people that inspire others, and also this will help. For example, for an important challenge we have is the collaboration between private and public sector. So if we all work in the same direction, I think we will speed up this process, as you mentioned.
Cool. Thank you.
I think one of the biggest challenges is in this transformation is just the cultural thing to change mindsets. And I think that a good tip could be start with your early adopters, because I think that these people who is really convinced about the advantages of the changes you are going to implement are going to involve other people who is not so convinced. So talk to your leaders, to your clinical leaders, and try to make them early adopters and to involve the rest of the organization. I think that's the clue.
Thank you. Max?
Yes, I have a bit of a more pragmatic approach here, because I run a startup, so we cannot wait too long for people to embrace this kind of change of paradigm, because otherwise we would be dead financially, right? So we take a bit of a pragmatic approach, which is let's solve people's problems today. So we're working with care providers, for instance, and we're really analyzing what are their issues today and how can we make their life easier today. And step by step, we want to build a critical mass of people using our solution. And then over time, really move towards a different model, which is more preventative in our case, much more personalized, but starting with the solutions that they need today, which is typically efficiency gains or savings in the case of payers or in the health systems. And for us, really, that's the entry point, right? Is to say, how can I solve your problems? How can I generate savings for you today? Because that's what matters on your balance sheets today. But over time, be part of your ecosystem, build that strong collaboration, and together really shape that new journey towards a change of paradigm to some extent.
Cool, great. So I'm hearing you talk about the early adapters. I think Mario is talking about them as well. The fact that there's a big room and I will be able to reach only part of it, and Elena as well. And I hear you talk about inspiration. And the question that pops to mind is, what is your secret weapon when you're trying to captivate these early adapters? I mean, I'll give you an example. At Clalit, what I do a lot is I use a lot of design thinking methodologies in order to help physicians create empathy, or at least a different empathy for their patients, because they are empathic to patients, but it enables them to have a different communication with them. And I've seen over and over again how doctors that know their patients for 10, 20, 30 years have this different conversation with their patients that is much more intimate and much more emotional, and they get new insights. And that's my secret weapon. I have this methodology, these systems that enable them to have a deeper context of not just the disease, but the patient. I mean, what's your secret weapon?
I think that we have to invite doctors to be part of the solution and the ecosystem. They have to help designing the new solution for patients too, as well as patients. I think that every one of the players on this new ecosystem that puts the patient in the center of it has something to say about it, and has to say, I can help in this role or doing this thing, or I need this kind of tool to make to improve or to help in this ecosystem. So you have to gather all the stakeholders that are involved in that, and then create a collaborative solution, right?
Cool, great, thanks.
I would say that innovators and early adopters are there. You just need to identify them. Once you identify them, you need to give them visibility. And at the same time, you need to give them resources. And you put a good example. You need to give them methodologies. You need to give them technology. You give to give them how to manage their emotions, because this innovation journey is quite hard. And from my point of view, this is the key, is to identify them and give them the resources to really be an example and inspire the rest of the people.
Well, I can share with you my personal experience with one of the greatest technological advances in surgery. When I was a young surgeon, I performed open surgery, so it had a lot of advantages. First, I could put my hands, and touch the organs, and surgeons usually develop a very fine quality in our fingers, so it's like they are like eyes, so we can have an image of what's going on, especially when you're operating in very deep fields. But then something strange came to the market. It was called laparoscopic surgery. All of you know about that. At that time, it was, the first demonstration in the whole world. And, you felt so clumsy because you have to look at a screen with two dimensions. So you didn't have the depth. You had to operate from outside. And, of course, the instruments were completely strange. So you don't look at a demonstration at a conference and then you go to a patient and you tell that patient, I'm going to operate you with this new kind of operation, because the patient will look for another surgeon, of course. But you start working with a strange box, and then afterwards you go to the animal, special animal that has a gallbladder, which is very, very similar to the human gallbladder, and you learn to remove the gallbladder, and then you have to assist other good surgeons to help you learn that technique. And at the beginning, you feel so clumsy. As you said, I mean, it's quite unnatural. It's so much out of our comfort zone that we fear to feel ashamed. So when somebody who is proficient in that kind of technology really is empathic, he or she understands that you really want to release or reduce human suffering, and goes with you, that's much, much, much easier, because you don't feel so clumsy, you don't feel so much afraid. And after learning laparoscopic surgery, I really love laparoscopic surgery because it gave so many benefits to the patients, because the holes were so tiny. The pain after surgery was very little, and those patients could return their professional lives without any problem. But first, you need to feel the passion. This is a new way of doing things. Then you need to be willing to become a beginner, no matter how proficient you are in the old technique. Mm-hmm. Then you have to start that, roller coaster experience in which you feel clumsy. Little by little, you start to learn, surrounded by people who really want you to learn, and then afterwards you become so comfortable with the new technique that you ask yourself, why come that I was so comfortable before, and now I can operate just in 2 dimensions? So I think it's more or less what happens with all of us. There are, of course, people more proficient with those things because they have more ability, but in general, I think that's the process.
Thank you. And Max, Digital Max.
Yeah, thanks. I think just to add on what you guys said, I think user delight is important as well. I think the experience of a patient is really important. And whenever we talk about technology or innovation, I think we've often missed out in terms of really a very seamless experience of the patient in this journey as well, or of the clinician in this instance as well. So user delight for me is really part of the recipe here.
Cool, great, thank you. So our time is really, really nearly up. Maybe we have just one more sentence of conclusion from each and every one of you, maybe a call for action following this conversation. Let's start with Max this time.
Yes. That's very kind. I think that the call for just to more for the public sector to embrace, usually when we talk about patient quality of life, it's very much related to the health system's ability to embrace new models. And for us, this is really the key barrier, is to have the ability to sandbag, to create, to test, to sandbox new ideas and new innovations, and be supported in that journey, because otherwise we just keep practicing the old way, and there's so much potential. So really call for public sector or health systems, policymakers to embrace new ways of working.
Thank you. Elena?
So for me, as a conclusion and advice, I think that new technologies are going to give us huge possibilities, huge new capacities, but we do not have to give our back on quality and humanization. That has to be the basis, or continue to be the basis, of the healthcare that we are obliged to provide to our clients, to improve and to help them get a higher amount of life in terms of quantity and quality.
We're nearly up. Just one sentence, please. Pedro and Mario.
In one sentence, in the long run, I think we need to move health systems to be, instead of being reactive, to be proactive, but even predictive.
It's not technology or humanism. It's technology and humanism, hand by hand.
Thank you very much. I really enjoyed this talk. Thank you.
Yeah.